Hey everyone, and welcome back. Today we're doing something a little bit different. We're taking a deep dive into a fictional medical case study. It's all about rabies, and it's going to help us understand how doctors diagnose and treat this really serious illness.
Oh, I love a good medical mystery.
Right. So the case we're looking at today comes straight from the OpenStax Microbiology textbook, and you can find a link to that in the description. But just a heads up, this is a made-up scenario, just for educational purposes. So think of it like a medical mystery we're going to solve together.
Sounds fun. Let's do it.
Okay, so let me introduce you to our patient, David. David's a journalist, and he's just gotten back from traveling all over the world. We're talking Russia, China, Africa. He's been everywhere. But now he's not feeling so good. He's got weakness, fever, headache, and he's really agitated. And there's one more important detail. He got a dog bite while he was in China.
Okay, a dog bite. That definitely throws up a red flag right away, especially when you consider where he's been traveling. Rabies is a big concern in many parts of the world, and dogs are unfortunately a common source of transmission.
Exactly. And to make things even more worrisome, David's now feeling this kind of strange prickling and itching sensation around where he was bitten.
Oh, now that's a really specific symptom, and it would definitely make any doctor think of rabies. Those sensations, along with his other symptoms, could be some early warning signs.
So David does what anyone would do. He goes to see his doctor. What happens at that initial visit?
Well, the doctor starts by doing what's always important, ruling out the most common causes. So in this case, they need to check for a bacterial infection. They'll take a sample from the bite and do a culture and sensitivity test.
So they're basically trying to grow any bacteria that might be in the wound to see what they're dealing with.
Exactly. But here's where things get interesting. The test comes back negative. No bacterial infection. And that shifts the focus to something much more serious.
Okay, now I'm really intrigued. We've got this negative bacteria test, a dog bite, and these neurological symptoms. It's starting to point toward rabies, right? But how do you actually diagnose rabies? It's not as simple as like a strep test.
You're right. It's definitely not simple. Diagnosing rabies is a real challenge. There's no single test that can give a definitive answer while the patient is still alive. Doctors have to put together the pieces using the patient's history, their symptoms, and a bunch of different lab tests.
So it's like a puzzle. You have to look for clues from different places.
Yeah, that's a good way to put it. And in David's case, the doctor orders several tests to get a clearer picture. First up is a blood test.
Okay, so what are they looking for in his blood?
They're looking for rabies antibodies. Antibodies are these amazing little proteins that your immune system produces to fight off specific invaders like viruses. So finding rabies antibodies in the blood would be a pretty strong indicator of an infection.
So they're not actually detecting the virus itself, but the body's response to it? That's really interesting. What other tests are they running?
Next up, they take a sample of David's saliva. There are a couple of things they can do with that. One is called RT-PCR. It's a way of looking for the virus's genetic fingerprint. It can actually detect the genetic material of the virus if it's there.
Wow, so they're basically doing some microscopic detective work. What about the other saliva test?
That one's called viral cultivation. It's like trying to grow the virus in a lab. If the virus grows, then we know for sure it's present.
Okay, so we've got the blood test, the two saliva tests. What?
One more important test. The doctor takes a small skin biopsy from the nape of David's neck. They're specifically targeting the cutaneous nerves, which are those little nerves close to the hair follicles. They'll analyze this sample using a technique called immunofluorescence staining. And what they're looking for are, you guessed it, rabies antibodies.
Wait a minute. Why are they looking for antibodies in the skin biopsy again? Wouldn't it be easier to just look for the virus itself?
That's a great question. Here's why they do it. The rabies virus is really sneaky. It travels through the nerves and replicates there. By the time someone starts showing symptoms, the actual virus itself might be really hard to find in the blood or saliva. But the antibodies, those little soldiers we talked about, they hang out in the nerves and they're much easier to detect at that stage.
Okay, that makes sense. So we've got all these tests running. What happens next?
Well, the first result that comes back is the blood test, and it's positive for rabies virus antigen.
Hold on, antigen. I thought we were talking about antibodies. What's the difference?
You're right to ask that antigens are kind of like the name tags that viruses wear. They're what trigger your immune system to produce those antibodies we talked about. So a positive antigen test means they've found evidence of the rabies virus itself in David's blood.
Oh, wow. So now things are getting serious. A positive antigen test, that's a game changer, right?
Absolutely. With a disease as dangerous as rabies, doctors can't wait around for the other test results. They need to act fast.
So what happens next? Do they start treatment right away?
They do. In the next part, we'll get into all the details of the treatment and what those other test results reveal, because trust me, this medical mystery is far from over.
All right, so last time we left things on a bit of a cliffhanger. We found out that David's blood test came back positive for rabies, which is obviously a really big deal. But we were still waiting on those other test results from the saliva samples, the RT-PCR, and the viral cultivation test, right?
That's right. Those tests are designed to look for the actual virus or its genetic material, so you would think those would give a more clear-cut answer.
Yeah, exactly. So what did those saliva tests show?
Well, here's where things take another unexpected turn. Both of David's initial saliva tests come back negative.
Wait, negative? But his blood test was positive. How is that even possible? It feels like we're going backwards.
I know it seems strange, but it's actually not that uncommon to have a negative saliva test even when someone has rabies. There are a few reasons why that might happen.
Okay, so help me understand this. Why wouldn't the virus show up in the saliva if he actually has rabies?
Well, the amount of virus in the body, what we call the viral load, it can change over time. It really depends on where the virus is and how long it's been since the infection. So sometimes the amount of virus in the saliva might just be too low to be detected by the test.
So it's kind of like a timing thing, like maybe you just caught him on a good day as far as the virus is concerned.
Exactly. And the tests themselves aren't perfect either. There's always a chance of what we call a false negative, which means the test just doesn't pick up the virus even though it's actually there.
Okay, that makes sense. So then what does that mean for David's treatment? Does the doctor just stop everything based on these two negative tests?
Well, that's the tough part. Because rabies is so serious, doctors can't take any chances. Even with these negative tests, they still have to be really cautious.
So you're saying even with a negative saliva test, you still can't rule out rabies. That's important to know.
Absolutely. Remember that positive blood test we talked about? Well, that combined with David's symptoms and the fact that he got bitten by a dog in an area where rabies is a known risk, it's enough to warrant continuing treatment. It's kind of like wearing a raincoat, even if there's only a slight chance of rain. With rabies, it's just better to be safe than sorry.
Yeah, that makes a lot of sense. Better safe than sorry, for sure. So what happens next? Do they just continue the treatment?
They do, but we're still waiting on one more piece of the puzzle, the results of that skin biopsy. Remember that test was looking for rabies antibodies in those tiny nerves near David's hair follicles?
Right, because that can tell us if the virus has actually gotten into the nervous system. So what did the biopsy show?
Well, the skin biopsy also came back negative.
Negative again. This is getting more and more confusing. So we have one positive blood test and 3 negative tests. What's the doctor supposed to do with all this conflicting information?
It's a really tough call, but after looking at all the evidence, the doctor ultimately decides to keep going with the treatment.
Even though most of the tests are negative. Wow, that's a big decision. What makes a doctor decide to do that?
It comes down to weighing the risks. That initial positive blood test is a really big red flag. And you have to remember David's symptoms, the fever, headache, agitation, and that prickling feeling around the bite, those all fit with early rabies. Plus, he was bitten in a place where rabies is a concern. So taking all of that into account, it's just too risky to stop treatment just because of those negative tests.
So it's about looking at the whole picture, not just one single test result.
Yeah.
It really shows how complicated it can be to diagnose and treat these kinds of diseases.
Exactly. And in David's case, this cautious approach turns out to be the right one. But we'll get to that in a minute. First, let's talk about what that continued treatment actually looks like.
Okay, so walk me through those final stages of treatment. What does David have to go through?
So near the site of the dog bite, David gets another injection of rabies immunoglobulin. Remember those antibody soldiers we talked about? Well, this injection gives him a big boost of those antibodies right where the virus might still be hanging out. It's basically a direct attack to neutralize any virus that might be left before it can spread further.
So it's like a targeted strike right at the source of the potential infection.
Precisely. And to give him long-term protection, he also gets a series of 4 rabies vaccinations in his arm spread out over 2 weeks. These vaccines essentially train his immune system to recognize and attack the rabies virus, which gives him lasting immunity.
So it's a 2-pronged attack. Neutralize the immediate threat, and then build up his defenses for the long haul.
Exactly.
Yep.
It's a really comprehensive strategy to fight the infection on multiple fronts.
And all of this is happening with those initial negative test results still hanging over everything.
Yeah.
I can't imagine how stressful this must have been for David.
Oh, absolutely. Waiting for test results and going through treatment for a potentially deadly disease, it's incredibly stressful. But I'm happy to say that in David's case, the story has a happy ending.
Don't tell me he makes a full recovery.
He does. Thanks to the quick treatment and careful monitoring, his symptoms gradually start to get better, and eventually he makes a complete recovery. It really shows how effective that post-exposure treatment can be and how important it is to act fast.
That's such a relief. I was really worried about him. This whole case just emphasizes how important it is to stay informed about health risks, especially when you're traveling.
Definitely. And it really highlights how critical doctors are in making those tough decisions when things aren't so clear-cut.
Absolutely. David's case was a success story, but it's a good reminder that rabies is a really serious disease. And even though this particular case was made up, the things it shows us about diagnosing and treating rabies are very real for doctors and patients dealing with this every day.
That's a great point. Even though it was fictional, this case study really does a good job of showing how complicated rabies can be.
Okay, so we've reached the end of David's medical mystery, but I feel like we've just scratched the surface. What are the biggest takeaways from this deep dive into rabies?
Well, first off, we've seen firsthand that diagnosing rabies is not easy. There's no one perfect test, and doctors have to use a combination of observations and lab results, which, as we thought, can sometimes contradict each other.
Right, and those conflicting results can make things really tricky for doctors. But like you said, with a disease as dangerous as rabies, it's always better to err on the side of caution.
Absolutely. And that leads us to our second big takeaway. Early intervention is absolutely crucial. If you want to survive rabies, you need to start treatment as soon as possible. So if you ever think you might have been exposed to rabies, don't wait, go see a doctor immediately.
That's such important advice. Time is really of the essence with rabies.
Okay.
Hey, any other key points we should emphasize before we wrap up?
Yes, one more thing. Even if you're not traveling to an area with a lot of rabies cases, it's still important to be aware of the risks and know how to prevent animal bites.
Right? Rabies is a global issue, and it's something to be aware of wherever you live or travel. Knowing how to avoid animals that could have rabies and what to do if you do get bitten is important for everyone.
I couldn't agree more. Being informed is the best way to protect yourself and your family from this dangerous disease.
So we've really been through it with David, haven't we? From those first signs that something was wrong to all those tests and the really tough decisions that doctors have to make when they're dealing with a disease as serious as rabies.
Yeah, and even though David's story was fictional, remember it came from that OpenStack's microbiology textbook, it really shows us just how complex rabies is in the real world. It's a great example of how even these textbook cases can give us a lot of insight into, the challenges of diagnosis and treatment.
For sure. It really felt like we were going through all that uncertainty right alongside David, wondering if he had rabies or not.
And speaking of uncertainty, David's case was a great example of why it's so important to start that prophylactic treatment, even when you're not 100% sure of the diagnosis. It just highlights how crucial early intervention is when it comes to rabies.
Absolutely. Better safe than sorry, right? Especially when you're dealing with a disease that is almost always fatal when symptoms show up. David's story had a good ending, but it's definitely a stark reminder that rabies is a very real threat all over the world.
Right, and that brings up a bigger question that I think David's case raises. Given all his travels, Russia, China, Africa, what does this mean for preventing rabies and raising awareness in a world where we're all so interconnected?
That's a really good point. It makes you think about how easily a disease like rabies can spread now that we're all so globalized. International travel is so common that it's easier than ever for a disease to basically hitch a ride across borders.
Exactly. It underscores how important it is to be proactive about preventing rabies, especially if you're traveling to areas where it's more common. What you do before you travel is key things like getting vaccinated, being aware of the animals around you, and knowing what to do if you get bitten. Those are all really important steps.
It's like having a health checklist for travel.
Yeah.
Just as important as remembering your passport and your toothbrush.
Absolutely. And it's not just about individual travelers either. We need to think about how we can combat rabies on a global scale. That means more research and development of better diagnostic tools, better treatments, and of course, better vaccines to stop this disease from spreading.
So it's a multifaceted approach. You need individual responsibility and global cooperation to really tackle this challenge. It's a reminder that in today's world, the health of one person can actually have an impact on the health of many others.
Exactly. We're all part of a global community, and we need to work together to protect ourselves and each other from threats like rabies.
Well, this has been a fascinating look into the world of rabies. I feel like we've learned a lot of valuable information and some important lessons today.
I've really enjoyed exploring this topic with you.
And for our listeners, we hope this has been an informative deep dive. If you're interested in learning more about rabies prevention and resources for travelers, We'll have some helpful links in the show notes.
And remember, if you're planning any trips, especially to areas where rabies is a concern, be sure to talk to your doctor. They can give you personalized advice and make sure you have all the necessary vaccinations and information to stay safe.
That's great advice. We all have a part to play in preventing rabies. So stay informed, stay safe, and until next time, keep those curious minds engaged.